One part of President Obama's health care reform aims to keep hospital patients from being readmitted for chronic health issues. Now, one local hospital is working to help some patients to get the care they need before their problems get out of hand. Here's New York One Health reporter Erin Billups with more in part 4 of her special series.
A myriad of chronic health issues in 2010 meant 6 hospital stays in 6 months, on top of several emergency room visits for 59-year-old Lawrence Smith.
I have a heart problem and I have a kidney problem.
So he was flagged as high risk for readmissions by Mount Sinai Hospital's preventative admissions care team called PACT.
We created a model where the social workers go and interview patients, and it's a very in-depth assessment. It might be income, health literacy, issues in the home, issues around family that may be returning patients to the hospital.
For 5 weeks after being discharged, a PACT social worker was in regular contact with Smith. They helped him find daycare for his toddler granddaughter, get a cell phone, transportation to dialysis, and accompanied him to doctor appointments.
People can't deal with those things until the stress of everyday life is sort of alleviated.
PACT was started shortly after the Affordable Care Act passed in 2010, partly to avoid the new federal penalty for large numbers of readmitted patients.
We were able to reduce 30-day readmissions by about 40 to 50%.
Mount Sinai is one of many accountable care organizations, or ACOs, cropping up across the country. It's part of the reform law's shift away from fee-for-service care, focusing instead on more proactive, preventative care.
You absolutely have to change the framework. We can't have patients utilizing emergency rooms and utilizing hospitals as their health care. And we also want to be able to approach patients when they're at risk of these diseases.
The ACO model is mainly an effort to control Medicare costs, and there are still concerns surrounding the new approach. One being the availability or lack thereof of primary care doctors. But for Smith, the improved coordination between his healthcare providers means he's now able to live a more healthy, productive life.
Before I felt like it was like the end for me, and now that things is getting better, I feel that I'm going to live.
In Manhattan, Erin Billups, New York One.